Hi, I'm Dr. Joseph Maroon. I'm a neurosurgeon here at the University of Pittsburgh, and we've recently published a paper on what we've learned about neurosurgical and neurological problems relative to sports and sports medicine. And there's no subject that has garnered more media attention in sports than cerebral concussions. And we've been dealing with cerebral concussions here at the University of Pittsburgh at the professional and the college level for the last 25 years. And there have been amazing changes in how we manage concussions at the present time. Perhaps the most significant advance has been the use of neurocognitive testing, the so-called impact test, which I, along with Dr. Mark Lovell and Mickey Collins, have designed and pioneered, which is now the standard of care and used by over 4.5 million kids throughout the United States at the college and the high school and soon the Pop Warner leagues, as well as all professional teams. So that once a concussion occurs, the most important thing that we've learned is not to allow the athlete to return to sports participation until all symptoms and signs have completely resolved. No headache, nausea, visual abnormalities, sleep disturbance. All of this has to be completely resolved before the athlete returns. And then they need to pass and get back to their baseline on the neurocognitive test, the impact test that was performed as a baseline. So in management, that is probably the most important factor that we've learned about return to play. In terms of prevention, there have been an amazing amount of work relative to headgears, helmet protection, and also now the use of accelerometers inside and on the outside of helmets, which indicates that an average high school player can take between 600 and 1,000 hits per season to his head. Recently, a paper by Dr. Julian Bales at the University of Chicago has emphasized the potential importance of the so-called subconcussive blows. With these cumulative injuries or cumulative hits to the helmet, is there a significance in terms of the subconcussive blows and subsequent pathological and neuropathological problems within the brain? The bottom line is that because of the emphasis on concussions at the Pop Warner League, where there are over 500,000 kids playing, USA Football, another couple of million, and also locally at the high school level, there's been a very substantial drop-off in the number of athletes participating in the sport of football. One of the things overlooked are the incredible positive elements of participating in a team sport, the qualities of leadership, the qualities of tenacity, perseverance, don't quit, teamwork. All of these things are qualities that are learned on the fields of friendly strife, if you would, that carry over into these individuals' lives and future development and even occupations. So that there's a major controversy now about should kids play or not play. I think data is still accumulating, but overall, I personally believe that the benefits of the sport clearly outweigh the negatives, as long as proper safeguards are instituted and used to prevent the injury in the first place and to manage it appropriately if it does occur. Thank you.